Welcome back to the Dental C Suite. Today we're talking about subtle issues in dental clinics that quietly destroy teams.
AKA the silent killers. Those little office vibes that make patients uncomfortable and staff just miserable.
And by the time you notice, it's already costing you money, your sanity, and maybe a few chairs.
All right, so let's start with HR micro issues, starting with clicks. This one's huge. People naturally gravitate towards certain coworkers.
Kind of like in the high school cafeteria.
Exactly. And suddenly, two front desk staff are only helping each other, leaving the other team members out of the loop. Then tasks aren't done on time and tensions rise.
And I bet that creates gaps in your schedule as well, eh?
Massively. Then there's the passive aggressive behavior. You know the ones, the sighs, eye rolls, those nice comments that aren't nice at all.
Oh, yeah. Like, wow, actually remember to do that. Good job.
Exactly. And seniority culture. Long tenured staff thinking they know best, resisting new protocols, rolling their eyes at training sessions, that kind of thing.
So all these tiny things, they snowball?
Big time. Owners often don't even notice until turnover hits or the office feels chaotic.
So, Jess, what do you do?
Small, consistent coaching. Call out the behaviors respectfully and privately. Ask questions like, I noticed this happening, or I noticed so and so saying this. What do you think we could do differently? And reinforce positive behaviors. Even role playing in team meetings is helpful too.
Role playing, like, you mean, okay, front desk, now pretend you're not annoyed at the hygienist.
Yes. Yeah, exactly. Better rehearsal than a meltdown in front of the patients.
All right, now that part that hurts, your bottom line. Subtle dysfunction hits revenue fast.
Can you give me an example?
Sure. Let's say the hygienist and front desk aren't talking because of a small conflict. The hygienist thinks a patient is already confirmed. The front desk thinks that they'll call. No one calls. Patient no shows, empty chair, lost revenue.
All because someone just rolled their eyes.
Exactly. And miscommunication can affect billing too. I've seen cases where a treatment wasn't logged, insurance claims delayed, and patients called frustrated. That's literally thousands of dollars slipping away quietly.
Yikes. So micro issues are secretly money leaks too.
Yep. And turnover adds insult to injury. Hiring and training new staff, lost productivity, onboarding, it all costs money.
So, if your front desk fights with the hygienist, you're bleeding dollars. Got it.
Yep. And owners often blame the system, not the underlying team dysfunction, thinking that we can systemize this and get around it.
And here's the patient side. Patients, they'll notice this tension immediately.
They really do. Even subtle eye rolls or curt responses, it's obvious.
When your front desk staff are constantly whispering or rolling their eyes at each other, patients will pick up on it. And your clinic reviews will reflect that. Things like, great dentist, but the office feels tense. Ouch. That does nothing to build a strong brand. That does nothing to build a strong brand for your clinic.
That's like revenue loss disguised as bad vibes.
Exactly. And as you said, turnover makes it even worse. Patients hate meeting new faces constantly. Plus on the phone. Oh my gosh, the phone. If your receptionist sounds annoyed while booking appointments, remember, that's the first impression your clinic gives new patients.
So internal culture really literally shows up externally.
Yep. You got to remember, marketing, it isn't just ads. Your brand, it isn't just the logo and the font on the sign above the door. It's the vibe that your team gives off. Cohesive, happy team equals loyal patients, great reviews. Toxic micro issues, exact opposite.
And combined with the accounting side, lost revenue plus unhappy patients equals a nightmare for any dentist.
So if you're a clinic owner thinking, it's just a little sigh, it'll be fine. Think again because clicks, passive aggression, and seniority culture quietly destroy teams.
And that destruction isn't just emotional, it hits schedules, productivity, and revenue.
And your patients, they're going to notice. which affects loyalty, reviews, and ultimately your reputation.
So the solution? Address issues early, coach consistently, and lead by example. Owners set the tone. How you respond to small tensions shapes your entire clinic culture.
Think of this as invisible marketing. Good culture is going to keep patients. Bad culture is going to drive them away.
And good culture keeps revenue steady, but bad culture drains it.
Exactly. So that's it for today's episode. Thanks for listening.
We'll catch you next time, hopefully with fewer sighs in your office.
And maybe a little less money lost to drama.
And a team that actually enjoys coming to work.